Welcome to Pharmative Live on Facebook Live. My name is Dr. James Partyka. I'm an oncology research scientist, clinical pharmacist, and the founder of Pharmative.com. Pharmative is all about connecting patients with healthcare professionals and scientists in order to educate ourselves so that we can make informed decisions about our healthcare with our healthcare professionals out there, for you, for your family members, for your loved ones. That's Pharmative.com, and membership is forever free. Just go to Pharmative.com, use a valid email, confirm your email, establish a username and password, go to the main menu in the upper right-hand corner and select Find and Join Networks. There's over 15 healthcare networks of your choosing. The ones you choose will populate your trending feed, and that will create your social media healthcare environment. And Pharmative is the first social media network dedicated to your healthcare. And today, Pharmative Live is sponsored by our PNN.1 Plus Health mobile app. You can get your mobile app at your Apple and Android stores today. Not only does it have great music from Pride Nation Radio, but it also has great entertainment, TV, films, but also a number of vital healthcare resource tools right at the fingertip. Right at your fingertips. As long as you have your phone, you have your app, you're good to go. So check that out, the PNN.1 Plus Health mobile app. Today we're going to be having a very short Pharmative Live. I just want to reach out and shout out to Helen out there. Jimmy's on a plane today. Alan, hi. You can text me your messages. You can send me your emails ahead of time to info@pharmative.com. We're changing our time slot. We're now going to be available at 9 a.m. Pacific Coast time every Sunday morning. And for previous episodes, you can always obtain those through a Pharmative YouTube page, or you can go to Pharmative.com under Pharmative Live Network, and you'll see all of our past episodes on various healthcare topics. That's Pharmative Live on Pharmative YouTube. Today is entitled the Pharmative Vaccine Challenge. Okay, and I'm going to challenge each and every one of you after today's 10-minute episode, and I'm going to try and get our forums back down to 10 to 15 minutes. And today won't be any longer than 15 minutes, and hopefully we can do it under 10 minutes. So I have good news to talk to you all today, is to say that 1/3 of United States adults are fully vaccinated. That's a great achievement and accomplishment. We still have some ways to go to reach that herd immunity level of about 75%, but we're well on our way. Now, the more people that get vaccinated, the more we will decrease the burden of the virus in our neighborhoods, in our communities, in our countries. And that will decrease the likelihood of mutations, which may be, and so far we have identified a number of mutant strains of the virus that are more virulent. That means they cause more severe disease and that are more contagious. So we need to not only reach the goal of vaccinating all qualified eligible patients in the United States to get vaccinated, but we also need to eventually reach out more to various countries from decreasing the burden of disease in those countries as well. Otherwise, we're not going to eliminate the disease from the world. So this is a life-threatening pandemic. We're probably already very familiar with the facts, but I'm going to focus today on vaccines. And 14 diseases have been brought under control or cured of the disease through the technology, through the medicine of vaccines. And those diseases include polio, tetanus, influenza, hepatitis B, hepatitis A, rubella, measles, whooping cough, pneumococcal disease, mumps, chickenpox/shingles. As you get older, there's a vaccine available that prevents your risk of getting shingles, which is a very painful variant form of the chickenpox disease that many of us had as children, and diphtheria. So vaccines have been around for decades and have definitely proven their value in treating and preventing disease. And that's very true with the COVID-19 vaccines. As you know, we have 3 that are available in the United States. The Moderna, 2 shots, the Pfizer BioNTech shot, which is 2 shots separated by 3 weeks. And finally, we have the J&J vaccine, which is 1 shot. All 3 vaccines are safe, are effective at reducing moderate to severe disease, at reducing hospitalization rates, and decreasing the death rates. So these are highly effective vaccines. They're extremely safe. And the worldwide evidence that we have now in our communities support everything our clinical trial data showed us, which is they're extremely effective. We're talking about 95% effective at preventing COVID-19 disease. And nearly, I want to say 100%, but nearly 100% at preventing hospitalizations and preventing mortality. That's great news. The vaccines are widely available at your local pharmacies and clinics and vaccination sites throughout the country. There's no reason not to get the vaccine. The vaccine cannot cause you from getting COVID-19. Cannot, because it is not made with the live vaccine. It's basically all 3 vaccines stimulate your own bodies to produce antibodies towards the spike protein located on COVID-19. The Moderna and Pfizer vaccines are made with similar new technology, which gives your immune system the code for producing, that code being the messenger RNA, to produce the spike protein, which then means that your body is ready and armed once that virus tries to enter through your nasopharynx, through your mouth. It's ready to go, and your immune system will wipe it out before it has a chance to multiply and spread within your body. 3 safe and very effective vaccines, and readily available. So the good news is 1/3 of the United States has been fully vaccinated. And now we have to get up to that 75% number, which represents the concept of herd immunity, which just means that the burden of disease is so decreased that the people vaccinated, whether that's because they've contracted previously COVID-19 or they've been immunized with the vaccine, prevents the spread of disease by actually blocking someone who's unvaccinated from someone who has the disease. And therefore, the majority of people, the 75% or higher, are blocking that disease from spreading. That's what's referred to as herd immunity. All right, so some good news is that the FDA this week is looking at Pfizer data to approve for national emergency use the Pfizer vaccine for children 12 to 15 years of age. So hopefully within the next week or so, children of the age of 12 to 15 can get the Pfizer vaccine. And as you recall, that the Pfizer vaccine wasn't originally approved for 16 years of age or older because they included that subset of patients from 16 to 18 in their study, and that's how they got the national emergency use for 16 and above, and now they're submitting for national emergency use for 12 to 15 years of age, which is another great reason to go out, talk to your family members, educate them, go to PHARMATIVE YouTube page, and read up or listen to me talking about how the facts about the virus, and then tell them about the facts about the virus. You know, there's a lot of misinformation out there. Again, I want to, reach out to you and say, get your information from the reputable subject experts, from the reputable news sources out there, like the FDA, like Dr. Fauci, like the CDC, like your own physician, your own pharmacist, as well as reputable news sources out there. Don't go through social media, unreliable sources, and read up on all this crazy misinformation stuff. It's not true. The facts speak for themselves. The vaccines work, they're safe, they're effective, and there's no reason for you not to get the vaccine. The second point on this is those people that have had COVID-19 are also encouraged to get vaccinated. And that's because we don't know how long natural immunity lasts. That's number one. And number two, there are mutations out there. Those mutations are more virulent, okay, and more contagious. So getting vaccinated will help prevent you from getting that disease as well. So again, COVID-19 patients that are fully recovered should get vaccinated. All right, we're making progress here. All right. So, there's one other very important point that I need to make to all of you. You don't want to get this disease, not only because of the short-term complications, but because of the long-term complications that are emerging. So people that have recovered from COVID-19 still may have chronic fatigue, still may have confusion, still may be having high levels of anxiety, depression, dementia. They may have lung scarring from having recovered from COVID-19, pneumonia. They may have heart damage. They may have clotting problems. So it's not only the short-term complications of COVID-19, it's the long-term complications just as much. And then the next important point is it's not only about your health, it's about your neighbor's health. It's about the workers that work in your family business. It's about their health. It's about your family. It's about your friends. It's about your loved ones. There is absolutely no logical reason why you should not get vaccinated. Okay? None whatsoever. Everyone should get vaccinated. And if you do have a question, okay, because there are subsets out there. For example, there are patients out there that are immunocompromised. Speak with your immunologist / physician / oncologist. Patients with that have a full immune system, they're immune reconstituted, they have normal white blood cell counts, should be able to get vaccinated. But if you do have another comorbidity, like a history of severe allergic reactions, talk with your pharmacist, talk with your physician, get the information. More than likely, you still qualify to get the vaccine. So now I'm going to teach you a simple, easy way to find out where the nearest vaccination site at your pharmacy or clinic is. You just text to GetVax, GetVax, your zip code. So in the to field, you type in GetVax, GetVax. That's also on our website. That's also on our Pharmative Facebook page. Your zip code, and within 30 to 60 seconds, you'll receive a listing of sites in your area where you can get vaccinated. A lot of the sites are now allowing for walk-in appointments, so you don't need an appointment ahead of time. You do have to make sure that if you get Moderna and Pfizer, you follow through 4 weeks later for the Moderna, 3 weeks later for the Pfizer, and get your second shot. If you get the J&J vaccine, you're done after one shot, which is painless. Now, in the future, they're developing perhaps oral vaccines or skin patch vaccines. So in the future, if we do have to get booster shots to various variants of the virus. It should be easier. In research right now, they're developing oral antiviral therapies and IV therapies as well as other dosage forms of therapies, so that if you do have the symptoms and you do test positive COVID-19, you get a prescription immediately and you get that antiviral therapy immediately to prevent you from going to the hospital, from getting moderate to severe disease. So there's a lot in the pipeline. There's a lot of research that is still being conducted. We're going to be dealing with this virus for years. That doesn't mean that we're not going to be able to return back to a normal life this year, which we already are starting to do. So those people that are fully vaccinated out there don't have to wear a mask outdoors, okay? And can congregate with other family members or friends if they're fully vaccinated indoors. So there's so many advantages, but the biggest advantage of all is preventing you from ever getting COVID-19. So here's the PHARMATIVE challenge, the PHARMATIVE Vaccine challenge. You have all the tools. You know where to go. You know why you're going to get vaccinated. You know what the short-term and long-term complications. If you need a refresher course, go to PHARMATIVE YouTube or go to pharmative.com, because all of that information has been there. We've been reporting on the COVID-19 since the very beginning, the first weekend in March of last year. We've been reporting on this pandemic, okay? And we're making lots of progress. That's a positive thing, okay? So the PHARMATIVE Vaccine Challenge, find someone, and I'm sure you'll be able to, who doesn't want to get vaccine, and try to convince them why they should, and get them vaccinated, whether you have to offer a ride share to the vaccination site, but get them vaccinated. I've had several workers come to my home, haven't been vaccinated. They're young, they're healthy, they think they're not going to get the disease, they don't have to worry about it, they're very busy with work and taking care of their families. But make time for yourself and for your health and your family's health and get vaccinated today. Do that today. Do that as soon as you can. It's an easy thing to do. It doesn't cost you anything but a little bit of your time. So go out there, guys. Do the PHARMATIVE Vaccine Challenge and let me know how many people you were able to get vaccinated. I think I've already convinced one, okay? It's a little challenging because these people are very headstrong and they're very reluctant for different reasons why. It is not a political thing. It is a public health issue, matter, concern, and it is about your life and leading a healthy life. Getting vaccinated, not only for yourself, but to stop the spread of disease in your neighborhood, in your communities, in your areas of the country. So get vaccinated today. Go out there and do the PHARMATIVE Vaccine Challenge, and let's crush this COVID-19 virus for good. That's it for today. In the meantime, stay healthy, as it's easier to prevent disease, and in this case with a vaccine, than it is to treat a human disease. I'm Dr. James Partyka, also known as the PHARMATIVE Guy, and you have a great day. See you next time at our new time slot, 9 a.m. every Sunday morning, Pacific Coast time, right before Oprah. All right, have a good one.